Hello there, Lisa Starr back with you. Happy to be at the beginning, at least, of another season of the Starrcast Podcast. We are recording this in mid-August, but you'll probably hear it in early September. But it is about an issue that is not going to be gone by then. We are going to dive this week into something that's actually been in the news quite a lot. It is microplastics. Now, when I heard the word microplastics, I thought, okay, this is like Tupperware, right? It's like things about plastic in our house that we're using, or shampoo bottles. But one of our guests has been sending me pretty much daily links to the news about microplastics. So I've learned a lot, and I've learned that they are in so many more things than I ever would have thought. They're not always in the plastic things in your house. They're in cosmetics that you put on your body, probably the lipstick I'm wearing. So they're in so many things now, and they are dangerous, and we don't know what the long-term use or results will be, but it's probably not good, right? So we are joined by two great guys today, friends, but also very scholarly, smart people who are working on this very issue. We're having Dr. Gerry Bodeker. He is a public health researcher who has spent 20 years at Oxford. He is also an adjunct professor of epidemiology at Columbia, and he is the founding co-chair of the Mental Wellness Health Initiative for Global Wellness. And we have Trent Munday, Senior Vice President International of Mandara Spa. Both of them joining us from Bangkok, as it were. They're in the same city. So welcome, gentlemen. Thank you for joining us.
Thanks, Lisa. Great to be here with you.
Same. Good to see you again.
Good to see you. So microplastics. Not the first thing when I think of when I heard the word wasn't you and Gerry and I talking about microplastics. So tell me, how did you get started on the microplastics mission? Dr. Bodeker, we'll start with you.
Okay, thanks, Lisa. Well, as you mentioned, I'm the founding chair and co-chair now with Elena Hernandez of the Mental Wellness Initiative in the Global Wellness Institute. And part of that role is keeping a watch on latest news on anything to do with mental health, mental wellness, the brain, and so on. And earlier this year, there was a study that I came across in Nature Medicine, which is the medicine breakout journal from Nature, which is the world's leading scientific journal. And in this study, the researchers had looked at the brains, post-mortem study, the brains of people with Alzheimer's and the brains of people without Alzheimer's. And what they found was, in the brains of people with Alzheimer's, there was 10 times more plastic than in the brains of people without Alzheimer's. That was such a shocking and new finding to me that I had a few thoughts. The first one was, well, I guess I probably have plastic in my brain and I'm not getting any younger. And how do I get them out?
And how did they get there?
How did they get there? We'll talk about that. But the next thing was, this is very serious for humanity. And what can we do from a wellness perspective to address this crisis facing humanity? And that got us started. And I talked to my good friend, Trent, about this. And that got us on a roll that Trent will tell you about.
Okay, over to you, Trent.
I guess from my point of view, as you mentioned, Gerry and I have been great mates for a long time now, and we regularly catch up just to talk about what's going on in the world and what's on our plate and what we're thinking about. And, I think what's happened here is it's kind of the upshot of what happens when I think two curious minds get together and throw some things around. For me, it was I was thinking about it at the same time. I was reading the same things. Probably not the same things, let's be fair, but I was reading some of the same news that Gerry reads, and it was becoming an issue. And it wasn't just the environmental aspect, which is all we've kind of heard about up to this point. Mm-hmm. Plastics are killing dolphins and turtles and whales. And listen, as a passionate diver for many, many years, I get that side of it completely. But it was the human element that really struck me. And as you know, I've got a little grandbaby in my life now. And I started thinking, how do we set her up for the best possible future to avoid being where we are now after 50, 60, 70 years worth of exposure to this stuff? And as I started to look around, it was just hard to find stuff for young kids, babies, infants that didn't have plastics everywhere. And to your point, it's in things we don't even think about. You know, it's the obvious things, but it's the non-obvious things. And so Gerry and I just started talking about it. And one of the things Gerry mentioned is there's just such a flood, a fire hose, as you described it, of information. How do we possibly harness all this into something meaningful and break through the noise? And that's where, you know, I play around a bit with some various tools and bits and pieces and AI. And we said, well, we could probably use some of these tools to gather the information, to collate the information, to harness that information, abstract meaningful stuff out of that, and then put that into something meaningful that can then be used as a tool, as a resource for the wellness community in general, people in general, and hopefully also the wellness initiatives, as we'll talk about a bit later, that can also use that resource to tap into their own unique field. So off we went.
Okay. So it's so great that it's a collaboration that came out of friendship, but a shared concern out of something that matters to many people and on different levels. So I gave sort of the layman's version of what's a microplastic. Maybe, Gerry, you can illuminate us more on what exactly microplastics are and how do they get inside our brains?
Yeah, sure, Lisa. Well, there's been quite a lot of research now documenting this reality that our species is pervaded by tiny bits of plastic. And microplastic, the definition is 5 millimeters or less piece of plastic. There's an even tinier level, which is called nanoplastics. And the European Union is looking into nanoplastics in food through the European Food Safety Agency. They've commissioned scientists in Europe to examine the content of nanoplastics in food in Europe. So food, of course, is one way that microplastics get into our body. How do plastics get into food, you'd wonder? Well, from the air, from the rain, from some of the fertilizers that are used. But let's look at the air first. It turns out that it's not the Tupperware and the food storage containers in our fridge that are the major source of plastic contamination in our bodies, although they are a source. The leading source turns out to be the air. And how do microplastics get into the air? Well, there's a simple major source, and that is car tires. Car tires we always think of as rubber, but they're not. They may have some rubber in them, but they're largely synthetic. And of course, with the friction of a tire on a road, of course, that friction rubs off tiny particles of the tire. That makes very understandable. Those particles happen to be plastic, and they go into the air, and the wind sweeps them up along with other, pollutants, and they swirl around our atmosphere, and we breathe them. And then it rains, and it comes down in rain and into the water supply. So that is the major source, breathing it. But then we drink it. It's in our water. Test after test around the world has found microplastics in every water supply that there is, from the Himalayas to the bottom of the Mariana Trench.
Really?
And yes, Himalayan snows to the bottom of the Mariana Trench. The whole planet is pervaded by tiny plastic particles. And it's not just, as Trent mentioned earlier, plastic bags on beaches and turning up in seagull stomachs and whales and so on. It is that, but that's just part of the story. It is in us. And it turns out that microplastics concentrate more in the brain than in any other organ system, the human body. And that gets us back to mental health and the Alzheimer's, the neurological damage, and so on. But it's also very alarmingly, and this gets back to the point that Trent raised about his baby granddaughter, it's in children. It's in fetuses. They're finding microplastics in sperm. They're finding microplastics in fetuses. They're finding microplastics in placenta. So from the human brain to the human reproductive system, we've got something that is attacking the integrity, the functionality, and the generational health of our species. This has never happened before from an artificial, we could call it a pathogen. It is that in terms of the body, but it's always been viruses and bacteria and so on that have been our invaders. Now it's something we've made ourselves from petrochemicals.
So we have this man-made thing that we're going outside and breathing unknowns to us, or we're drinking it. So it's coming into our lungs or it's coming into our stomach. I mean, does our body have no way to fight it off or eliminate it? I mean, what happens then? What's the science of this?
The science of it is that it stays in the body. And the Lancet, which you'll know is one of the world's leading medical journals, has now created what they're calling the Lancet Countdown on Plastics and Health. And they're monitoring progress in terms of data about this. And next year, they'll publish a really big report on the impact on human health. But there's been a chorus of voices saying, well, we can't say that because they're in the human body, there's an impact on human health. And the Lancet has published an initial piece saying, yes, we have lots of evidence that these pieces stay in the body. The body doesn't know what to do with them. They just stay there. And they act as surfboards into cellular material for viruses and bacteria. They cause inflammation. They cause oxidation. Oxidative stress is the basis of inflammation in the human body. Oxidative stress and inflammation are the basis of non-communicable diseases like cancer, heart disease, rheumatoid conditions, on, diabetes. So the Lancet estimates that $1.5 trillion a year globally is the health cost now of microplastics on human health. So they get into the body, they go everywhere because they're tiny, and the body doesn't know what to do with them. It does not mobilize an immune response because they're not organisms, they're not enemies that the immune system's used to fighting. They're bits of stuff, but they turn out to be bits of stuff made from up to 10,000 different petrochemicals that further degrade in our body and poison us with petrochemicals.
So this thing invented, as I read, in 1907 and, made our lives so much more convenient, ends up that it's turning us into plastic, it sounds like.
Yeah, and it's everywhere. It is, Gerry and I were talking yesterday even about this, and the idea that we're talking about the air and how it's all coming everywhere we breathe. And we think about the masks that we all wear during COVID. And I was on the BTS train here in Bangkok the other day to go see Gerry. And we're thinking, okay, what about the mask? How much plastic am I breathing in through that mask? I don't know what microplastics are in it. And, the little, what do you call it? The little nasal inhalers that you often see in Asia to clear your nose with a bit of eucalyptus straight into the brain. Because there you go.
Oh, Gerry holds it up. Right. Great.
Because everything that we do, as we talk to each other about this stuff, every little action that we do, we think about how much microplastic we've now just ingested. I've got my hands on my table with a rubbery, plasticky mat for my computer, and I do a bit of that, and I do a bit of that. How much microplastics have I just ingested? I don't know.
Right. You touch something, you put your hand to your face, and you do it without thinking. We don't walk around thinking our environment is killing us, but maybe we should be.
I was speaking to Mark Woodkey, who you'd know, who's
Hmm.
going to be on our new initiative that we're going to be starting very soon. And as I was talking to him, Mark's very aware of his own health and health in general.
Right. He's very healthy.
He's a very healthy guy. And he's sitting there as Gerry's just drinking from his cup. He was drinking from a coffee cup, which was a polystyrene plastic. And of course, as I said to him as he's drinking it and talking about how focused he is on removing plastics from his life, I said, mate, you've got it all in that coffee right there.
Mm.
Because especially when these things heat up, when these vessels heat up, that's when the microplastics particularly get released. And that's
Oh, really? So worse drinking out of something warm than cold, say.
well, in terms of that vessel, yes. If you've got a disposable cup and you've got hot coffee as opposed to a cold juice, then the hot coffee will release more chemicals,
Makes
we
sense.
know at the moment, than what the cold will.
Uh-huh.
So if you're using an electric kettle made of plastic, don't.
Right.
Don't, for sure. So what do we do? I mean, now, this is a pervasive problem. What do we do?
That is the big question. So there are categories of what we do. One of the what we do categories is how do we reduce exposure in our own homes?
Mhm.
Trent and I have been systematically going through our kitchens, throwing out black plastic kitchen utensils, which are everywhere, but they are a major source of microplastic contamination. So we've made piles of those in our respective kitchens and tossed them. Plastic containers for food. Ziploc bags are currently under a class action lawsuit by consumers who claim that Ziploc has not warned consumers of microplastic releases with the zipping and the locking. Ziploc releases microplastics into the contents of the bag and exposes people to increased contamination. Consumers are suing Ziploc bags over that.
So it's not as bad if you just wrap the food in plastic, but the act of zipping it up and unzipping it, which is the point of a Ziploc bag, is the bad part.
I think we don't have that scientific distinction yet. If you can, use aluminium foil, or if you can, even better, use wax paper like our moms used to do.
Right.
When Trent and I were growing up in different eras in Australia, our mothers wrapped our school lunches in wax paper and put them in a paper bag.
Not meaning to age you, Gerry, but no, mine wrapped it up in Glad wrap. That's what my mum did.
Different generations. Well, my mum did wax paper in a paper bag and
Not a banana leaf? Okay.
not a banana leaf in Australia, no. Gum leaf, maybe.
Yeah. So tell us about the UN Plastics Treaty. You mentioned that there's a lot going on with nations collaborating, and many of the links you've been sending me have to do with that. What are the chances that something useful will come of this?
Well, Lisa, this was something that started in 2022. 3 years on, in Geneva in August 2025, last week at the time that we're speaking now, there was a coming together of all the parties to the convention, the proposed convention, UN convention, UN Plastics Treaty, organized by the United Nations Environment Program. And the aim here was to hammer out limits to plastic production. And basically what happened was two camps emerged. One camp that wanted to cap plastic production because plastic production has been doubling every few years and is estimated to be in the hundreds of millions of tons in a decade or two every year. That's a really shocking thought. And so there was one group that was proposing put caps on plastic production. There was another group represented by petrostates and the oil and gas industry from which plastic derives. It said, no, recycle. Don't cap production. There's nothing wrong with plastic. There's no evidence that it harms your health. All the arguments we've heard in other
Sure.
environmental contexts by industries and countries that don't want to slow down on polluting. So unfortunately, what happened was the prevailing bloc was the naysayers who said, no, it's not really that kind of problem, just improve recycling. The chair seemed to be sympathetic to this view, and there was a lot of protest that the procedure was even contaminated from the beginning, skewed, and there was no treaty that came out of it, and a lot of anger, a lot of disappointment from countries around the world and from civil groups. Of course, nobody's giving up because the people who get it realize this is a snowballing crisis that humanity has never seen the like of. Something has to be done. And so they're going to try through the World Health Organization. They're going to try through sympathetic governments. The European Union is very much in favor of capping plastic production so they can start at country levels, if not at global levels. Everyone's regrouping, terribly disappointed, but regrouping because it has to be done.
It certainly seems like something has to be done. And the EU is great about that. I mean, they're so tough about organic. I hope that they do take the lead on that.
Yeah.
But a lot of what came out of this treaty, from what I was reading at least, was that the focus was still very much on the environmental aspects. The human health aspects of it were kind of a secondary part of the conversation. And so until we get that human health aspect on the front foot, on the front podium, if you like, I think those conversations are always going to end one way, because it's another, it's the environment again. It's the greenies. It's the save the whales, save the trees people. But I think once we realize, this is, I don't know, is it cigarettes again? This is something that is actually killing us as we speak.
That we've done to ourselves.
Right. So, and it's, again, I just keep saying this, but it's everywhere, everything I think about. We were talking before about in the water supply, washing your dishes. What sponge do you use? You use a sponge that's...
We're all wearing shirts. Is there any synthetic in our shirts? If that's the case, then it's tiny particles are being shed and touching our skin, some of which are being absorbed through the microcirculatory system into our body.
The frames of your glasses, the glasses themselves, perhaps, things going
You're
right.
scaring me. I'm going to have to live in a bubble now.
Well,
Glass
that's
bubble.
It can go everywhere, right?
A glass bubble, exactly.
As you mentioned, this is something that really has wellness ramifications to it. And Trent and I have been exchanging with the Global Wellness Institute for a couple of months now, and just a few days ago received a green light with great support from the Global Wellness Institute to establish a new initiative in the Global Wellness Institute called the Microplastics Watch Initiative. And Trent has set up a website to accompany this called www.microplasticswatch.com. Trent, why did you talk about that?
Well, yeah, the website was really just a response to this conversation about the fire hose of information, as was in many respects the white paper. How do we get this white paper to be a living document? Because as soon as you publish a white paper, it's outdated by the time the next lot of research comes in.
But wait, what white paper?
Correct. Can I come in on that?
Yes, please.
As I mentioned in the beginning, this concern started through the Mental Wellness Initiative of the Global Wellness Institute, where we saw this paper from Nature Medicine about plastic in the brains of people with Alzheimer's. And I was talking with Trent and I said, really, I'd like to do some sort of position paper on this, which would be a white paper in the context of the Global Wellness Institute. just so we can figure out what's the problem and what are the wellness paths that we can take to mitigate.
Right. What can we start to do as an industry?
Correct. And as people. And then I said to Trent, there's just so much, I'm feeling overwhelmed. And that's where Trent came in and offered AI solutions to organize the material and so on. And that really got us on track to doing the right paper, which we're co-authoring and co-publishing from the new Microplastics Watch Initiative and the Mental Wellness Initiative.
Okay. So you've written the white paper?
We've written the white paper.
Okay.
We will be submitting it to the Global Wellness Institute. We've already submitted a draft. We'll submit the final version in the coming week or so. And by the time this podcast is out, the white paper should also be out.
Well, first of all, I want to say kudos to you for creating an initiative and reaching out to the Institute. And they're so great about working with people who have passion interests that are important to our community. So thank you for that. Trent, I'm no surprise, Gerry, you relied on Trent for the techie and the futurist part. So Trent, now could you tell us about the website and how this white paper will continue to evolve?
Yeah, I mean, look, it was just a case of trying to harness that fire hose and try to control it a little bit. And, as we all know with AI now, so many things are possible with all of these LLMs, these large language models. You won't be surprised that I've been playing with a lot of this stuff as it comes out because it always fascinates me. And even in the days of trying to pre-train my own little model, probably 5 years ago, that was a disaster, but it just gets so much quicker and so much better. Then it became about fine-tuning models. And now it's not even about that. Now it's about what they call RAG training, basically getting a base model, putting your documents as part of that and become the ultimate authority on that. So that's what we'll end up doing with this white paper. It'll be a resource that we plug into our model. I've sort of created a little suite of AI, various AI tools, which we've called Lucient. And we've actually listed Lucient as a contributor to the white paper.
But wait, Lucient is something you, Trent, created.
Yeah, I mean, it's a combination. I'm not Sam Altman. Let's just put that on the table. I haven't created the new ChatGPT, but there's so many different tools out there. It's essentially a suite of products that are out there that I've sort of played with and tuned a little bit to our needs. And as part of that, we wanted to create something that we could constantly update the news because there was news every day. And so part of that was what we talked about initially was building a dynamic white paper, a living white paper. It's hard to do that with the current stack at the moment, just because each time you put the new news in, you either lose context of the previous one or you have to rewrite the whole process again. And we didn't want it to become disjointed from the original paper that we've created because so much has gone into that. And so then we thought, well, let's just add the site for now. Let's get all the news that comes in daily. So essentially, we're kind of scraping the web to find out what news is out there. We're doing, I think, currently 22 search terms on Google each time we run that process. We've then got all the articles that we find progressively around the web in various news sources that we sort of send to an email. That email then automatically extracts that out, puts it into our website as a new article.
Now that's fascinating.
Yeah, I mean, there's quite a bit behind the scenes. With that, we can also create a summary of that article, create a little AI-generated image with that article. We can then post that automatically onto our Twitter account in such a way that it doesn't appear as an automated post. You've probably seen on X or on Twitter now, a lot of posts come up as automated if they're done through bots. Ours doesn't do that, which is nice. It feels a lot more organic. And so that's just the start. I mean, that was just the baseline to get us going. And so from there, we're going to be able to progressively drill down on sort of mini white papers, if you like, on specific topics within this area, because it does touch everything we do. It'll touch every global wellness initiative. It'll touch every human in every aspect. And so there's so many things that we can do once we've got the corpus of data, which we're now accumulating. It's a one-stop shop for all your information on microplastics in many ways. as of today, I think we had 1,246 articles or something on our website. And that's, we couldn't have done that without AI. We could have, but it would have taken a couple of us.
We'd be having this conversation in a few years, right?
Correct. And that's the point. As Gerry said, that is such a fire hose and it's such a pressing issue, then nobody knows where to turn. And so we thought, if we can just harness a little bit of this AI tool that is out there, and if we can create our own little suite of products that work for what we need it to work for, and that's what we've got so far. It's not the most amazing website in the world. It's not the most graphically beautiful thing on the planet, but it's certainly very functional. It's certainly forming a great resource for us to
unique resource.
It is.
Well, good for you. That's awesome. And it's great that you two came together because you have these very different skill sets that are really going to help push this forward. So let me jump ahead. We have all this information now, which we'll see on the Microplastics Watch website as it evolves and changes. What do we do with the information, and how do we, those of us that work in wellness, a spa owner who's listening, a therapist, a developer, what can we do in the meantime to start to make a difference?
Yes, Lisa, we started on that, which we were talking about Trent's kitchen and my kitchen and your kitchen now and everybody else's kitchen. Get rid of as much plastic as you possibly can. Another thing in the water, researchers found that up to 90% of microplastics in water drop out if you boil water. That's a really, really important
That's effective.
bit of information. So now at home, I only drink water that I've boiled. I let it cool. If you put it through a filter, you can take another up to 5% out.
What kind of filter? What sort of filter
Metal
do you need
filter,
to?
not a plastic
Okay.
filter. A metal filter.
Sure.
So that is basic. That's our water, boil it and just drink boiled water. That used to be a very safe thing to do before we started putting chemicals in water to kill all the bugs. And it turns out it's a safe thing again. Another thing is washing food, obviously. Doesn't get it out of the cellular structure of our salad and whatever, but anything on the surface from the soil, it's very important. Another thing that's been found is that okra, lady's finger, the vegetable? It turns out that you remember that it's kind of sticky, and I believe the word is mucilaginous. It's a great word.
So appealing.
Right, so appealing. It turns out that okra water made from mashed up okra, the mucilaginousness pulls plastics out of the water. It's something, you can use in washing vegetables and so on. We've documented a lot of these in our white paper of what you can do. There is a new bit of research that we haven't put in the white paper because it's still inconclusive, but it'll come in one of the future releases, where a combination of a bran and a natural gel seems to constitute a microfiber or a prebiotic that also is showing signs of pulling microplastics out of the body. Another one that gained a flash of media coverage a month or so ago was when Orlando Bloom went to a London clinic in Harley Street and basically had his blood filtered in a process called apheresis. Apheresis is where the blood is taken, pumped out of the body through into some cleansing system and then pumped back into the body. Paid £10,000 for that, and the clinic got a lot of publicity and doubtless a lot of business from that.
But do we know if it helped get the plastics out?
That is the question. The European Commission, as I mentioned, has started this project with scientists on how do you measure micro and nanoplastic presence? There's no consensus on measurement. If you read how much plastic is in your water, some will say thousands of particles, some will say millions of particles.
Uh,
The estimates are all over the place because there is no systematic framework for measuring microplastic content in the human body or in food or water. So we've got to have that first. Measurement has to be put in place.
Agreed. I mean, if I could see, if someone told me like you have this much, and you're definitely going to react to that because it's much more than a concept. It's a number.
It's a number. And that, Lisa, in terms of the wellness industry, and you think of the medical wellness centers that are proliferating now, and the longevity centers and the lifespan and health span trends that are in place, all of which have a medical component. This is something that could quickly come on the radar, but they have to address the question that you've just mentioned. How do I know what my microplastic load is? How do I know that your procedure reduces it? Measurement is really, really important. So that's another thing. I think we'll see a lot more of that happening. I think we'll see supplements based around prebiotics that can carry microplastics out of the digestive system through fiber. We'll see promotion of air filters that can be measured to take microplastics out of our domestic air. Trent and I have been talking about that, and we believe there's a whole range of products. There's an Amazon worth of plastic-free products waiting.
Well, we have to start somewhere in tackling this immense problem. And thank you to the two of you for bringing this important topic to the forefront for those of us that work in the wellness world. And I'd also like to thank you, of course, for taking time out and joining us today. Dr. Gerry Bodeker, member at Green Templeton College and University of Oxford public health researcher, and Trent Munday, Senior Vice President for Mandara Spa. Both of you are initiative co-chairs for the new Microplastics Watch initiative. More information can be found at globalwellnessinstitute.org/initiatives. Thanks again to both of you, and I will see you in a few weeks in China.
Thank you, Lisa.
No problem.
All the best.